talk about PID, the causes of PID, the symptoms of PID, the complications of PID, and the treatment options for PID. PID stands for pelvic inflammatory diseases. These are set of diseases that affect a woman's upper reproductive organs. I'm talking about the womb, the fallopian tube, the ovaries, the pelvic cavity. Okay, these are the diseases that affect them, that targets them. What can cause pelvic inflammatory diseases? It can be caused by STIs, sexually transmitted diseases. If you don't treat them well, neglected STI, untreated STI can graduate to PID. So if you don't treat STI, especially chlamydia and gonorrhea, if you have it and you don't treat them well, it can graduate to PID. If you have other bacterial infections like bacterial vaginosis and other bacterial infections, it can also, and you don't treat them, if you don't treat them well, they can graduate to PID. If you, after childbirth, you have some infection that's not treated, okay, you can also have PID. Then after miscarriages, okay, if you don't really treat yourself well, observe personal hygiene well, you can also have PID. After abortion, if you do abortion in substandard way, you can also end up with PID. After pelvic procedures, you can have, even after washing your vagina, if you keep washing your vagina all the time, gouging, you can also have PID because you end up pushing microorganisms inside to travel up, ascend to your reproductive organs. So these are the causes. What are the symptoms? PID symptoms present with signs of infection. You have lower abdominal pain, you have pelvic pain, you have irregular menses, you have pain when you are urinating, you always urinate all the time, frequency of urination will increase, you always feel pain when you are knacking, you always feel irregular bleeding, intermittent spotting all the time, fever, chills, signs of infection. Then how can you treat it? How can you treat it? See, PID requires proper treatment. It responds well to antibiotics, but you have to complete your course, obey its terms and conditions. You have to treat yourself for good 14 days. It responds well to ceftriaxone, doxycycline, and metronidazole, but you have to treat yourself well. Complete the course well. Okay? Treat your partner as well. During the time of treatment, no knacking. No knacking. When you are treating yourself for this, make sure you treat yourself well. Treat anybody that you have come in contact with during that time, and also minimize knacking at this period. So what are possible complications that might arise if you don't treat PID very well? Inability to conceive, you may not even conceive. It may even block your tube. You may have blockage tube. You may even have tubal pregnancy. Even if you get pregnant finally, you may end up in the tube. You may even have abscess in your abdomen, in your pelvic. So treat your PID very, very well. Let me know if you have gotten this diagnosis before and if you have treated yourself well in the comment section. Spread this information.